You may be asking a question whether tummy tuck or liposuction is best for you. And when we look at anatomy, especially in the midsection around the tummy and the flank area, we have to look at the skin quality. If the skin is toned, there's dense fat, and the muscle is nice and flat, then liposuction will do a wonderful job in contouring and shaping you. However, if the skin is loose and the muscle has been stretched from pregnancy or major weight shifts, then doing liposuction will only make the skin looser and not help with the abdominal tone or muscle wall. In that situation, a tummy tuck must be performed. What is a tummy tuck? Tummy tuck is when we remove extra skin from the lower abdomen and reconstruct the muscle wall. If you've had pregnancies, one or more, or have had weight shifts, you're going to notice the skin is loose and your muscle is rather stretched. Sometimes we see a clear separation in the two six-pack strips running down the midline. A tummy tuck is designed to cut through the skin and fat. We raise that tissue up to the navel. At that point, the navel is released. That's your old umbilical cord. It tethers the skin to the muscle. Once we release that, we can lift the skin up towards the rib cage, exposing all the muscle wall. At this point, the muscle is reconstructed by suturing it flat and tight to the midline. Now the skin can be stretched and all the extra is removed. To simplify it, it's kind of like making a bed. You stand at the foot of the bed, lift up the sheet, and you pull out all the wrinkles. And that's essentially what we're doing with a tummy tuck. Mini tummy tuck versus full tummy tuck. What is the difference? It all has to do with where the loose skin is. If most of it is confined to below your belly button, then we can go across the bikini line, raise the skin, pull all the excess, remove it, and then make a nice meticulous suture line. This does not change the appearance of the upper abdomen. So if your stretch is localized to over the pubis, below the belly button, then a mini tummy tuck would be the perfect procedure for you. If the muscle is stretched above the navel and the skin is loose above the navel, then you have to do a full tummy tuck where we separate the navel from the skin, allowing us to raise it, tighten the muscle from top down, and then removing all that extra skin through the bottom part of the incision. So tummy tuck or abdominoplasty is a surgery that takes 2 to 3 hours. The recovery will take 2 to 3 weeks. First couple of 3 days may be a little more difficult. I like to use an injection which numbs the muscle sheath where all the nerves live for up to 72 hours. That first 3 days I think is critical. If we can get you through that part, it will be a very comfortable procedure. For most of our patients, it really is. We do give you muscle relaxants to help with your comfort, as well as some narcotics, which I find are used minimally when this injection is utilized. A mini tummy tuck would have a slightly shorter recovery because the dissection is a little less. You're more active within a week and a half to 2 weeks typically.